Well, good morning, everyone. It is 9:02 a.m. on November 29th, Monday. Thank you very much for being on the call this morning. First of all, I hope everyone had a fantastic, long weekend for Thanksgiving. I really do appreciate everyone being on the call. And I know you guys missed me last week. It was just too short of a week to get everything done there, but I do appreciate everyone being on these calls. We only have 2 left for AEP, so I'm glad that we're on these calls. But just as a reminder, if you do have meetings with clients and you do need to see someone during this time, please don't hesitate to do so. We are recording these calls as well. So like we always start the call, we are out there to improve the lives of our community with affordable healthcare. So again, thank you very much for being part of that mission. And as we always start, we have to always have one foot in the classroom and the other one in the field at all times. So I'm going to go ahead and pull up our training calendar for the week. Again, it's a little light because we're right in the selling season here, but a few things going on. This morning at 10 a.m., if you're in the Orlando market, Aetna is doing their grab and go events. This one's down at Osceola Parkway, and that is at 10 a.m. this morning. So if you're in the area and you wanted to pop in to get kits from Aetna, you can do so. If you are struggling to get kits, we do have them at the office, but we do recommend that you know how to order your own kits per carrier. That's really important. And if you're struggling with that, we're happy to guide you and get you the kits that you need. But there are pop-up kits that are going to be all across, wherever you're selling. So you can pop in and grab kits just like the one today at 10. At 11 o'clock, Devoted is doing their coffee and chat session. That is happening there. This one's geared for the Orlando market, but all are welcome if you are offering Devoted. As with all days throughout the training calendar, you'll see that the training calendar link at 8 a.m. has the Hpm Shop link in there for the YouTube video. And this is a walkthrough for the new Hpm Shop. So if you need a refresher, if you just, feeling a little loose about it, you can go in there and watch that video. I did cut it up into chapters so that way you can jump to the section that pertains to what you're looking for so you can get that done. Moving on to Wednesday, December 1st. Wow, December's already here. Devoted is doing an agent training. You can register there. That's at 8:30 on the 1st, this Wednesday coming up. They're also doing another one at 3:30 that day, so you can jump into those trainings if you need to when offering Devoted. Ascension is doing their broker huddle at 4 p.m., specifically for the Jacksonville market. You can jump in there if you're unfamiliar with the Ascension Complete, which is part of the WellCare Centene family. So if you're already contracted with Centene, you have it in your portfolio, so it's there. Moving on to Thursday, the 2nd, Devoted is doing their coffee and chat session for the Jacksonville market. That's at 11:30. So you can jump in there if you need to know more about Devoted. And at 2 o'clock on Thursday, working with providers, Nick's got provider training there. You can jump on that call, and he'll be glad to get you up to speed on what's going on with providers and how to market yourself using those providers. For Friday, December 3rd, United Healthcare, we now have the UH1, which is their individual and family plan product. They have Galileo, which is their virtual doctor visits. It's a really great program that they have built in. So they're doing training sessions. That starts at 11 o'clock on the 3rd, which is Friday. So if you need to know more about that, you can jump in there. And then last training for the week is Friday at 1 o'clock. Aetna's doing another grab and go session. And that's this time it's on East Colonial. So the address and information is in the training calendar here. If you do not have the training calendar, please reach out to a team member so we can get you connected with that. We want to make sure that you guys have the most accurate information when you are out there, because remember, training is very, very important for all of us because you're out there educating your clients and you got to know what you're talking about. So please take a look at your training. If you're feeling weak in any area, please let us know, and we're glad to help you and get a training on the calendar for you. So that's the training for the week. Hope you guys attend one of those. All right, moving on. Today is Monday the 29th, which gives us 9 days left in AEP. So in AEP ends December 7th. However, we have a lot of SEPs out there. We have a lot of 5-star plans. If you're selling in the Florida market or in your market, take a look at the 5-star plans that are available. So we really can continue to write all the way up until December 31, and that counts for 1/1 effectives. Okay, so many of you that are participating in our contests, you're going to ask, does this count towards the contest? And yes. So continue to write business throughout AEP, which ends not this Tuesday, but next Tuesday, believe it or not. But we still can continue to write. So, those folks that are newly eligible for Medicaid, those folks that are moving, those people that are turning 65, if you have diabetes, if you want a 5-star plan, you got to know your SEP. So we're going into that mini SEP lock-in from December 8th to December 31. And then in January, we have OEP again, and that's our get out of jail for free card. So any folks that are already on a Medicare Advantage plan can make one more change from January 1st to March 31st. So continue to push traffic, continue to talk to your members, continue to work referrals. That's how you're going to grow your business. So don't stop just because it's December 7th. You got to continue to market yourself. That's the key to success to year-round marketing and making this a career. Okay, so good luck out there for the last full week of AEP, and that's important. Keep your eye on the ball, finish strong, follow up on those leads. It's really, really important. And I do have a video here on how to schedule appointments. Just as a reminder and a refresher to a lot of you, I think it might help. All right, now moving over to Hpm Shop. We have great news. We're happy to announce that the WellCare issue has been resolved with Connecture. And so now you can write WellCare just as you write any other product on Hpm Shop. Okay, so those of you that are online should be able to see my screen. And you go out to your plans, you pop in the zip code that you are looking for. So just for this instance, we'll use our main office here, 32808, and then WellCare will show up there. So just for this example, I'm going to point out WellCare. So just like you do with Hpm Shop on any product, you're going to add to cart, and now you'll have the ability to either send the application to the beneficiary to sign and submit, or you can complete the form yourself. Okay, so you have the ability to do this for WellCare now. It was a long struggle, but we finally got it, complete and ready to go. However, we still will not be able to do CSNP or DSNP enrollments using Hpm Shop because that is a WellCare wish. They do not want to have those particular products available on third-party enrollment software systems like Connecture right now. That is something we're working on in the future to correct. But the core plans, the Giveback plans, those plans you can go ahead and do on Hpm Shop now. So for your last push there, you finally have WellCare in the mix there to do your enrollments. And this goes for all Centene products as well. So WellCare, Allwell, HealthNet, any of those products, Ascension Complete, you can use Hpm Shop to do your enrollment now. With the exception of CSNP and DSNP enrollments. It's just something that WellCare does not allow at this moment. So, okay, let's move on to the scope of appointment. And as a reminder, I'm getting a lot of feedback here regarding, the ability to do scope of appointments here and getting issues with enrollment. The main thing to take a look at is on the top left here, you've got dashboard. So always go to your dashboard and you should see which enrollments are out there. If you still have quotes, that means that your enrollment has not been completed yet. If you have any doubt, you can look up your member and search. But the only way that you know for sure is if you have a confirmation number for the application. If you're not shown a confirmation number on the application did not go through. Okay, I've had several people reach out to us and they're wondering why the app wasn't submitted and they just didn't complete the application. Maybe they sent it out and the member didn't sign it, and that was in one case. So the application was not completed, so the member had to sign it. Or the application was incomplete and never sent to the member. And again, there was no confirmation number, so we knew right away that the application was not completed. But before you get to the application, before you discuss benefits, always remember you must have a scope of appointment on file. Okay, so whether you're doing that by paper, you can upload it here at Hpm Shop. Okay, or whether you're doing it electronically by text or email, you have the ability to do that. But do not discuss benefits before collecting the scope of appointment. I've had several instances where people got really excited about using Hpm Shop and they went out and they picked the plan and all that. They totally forgot the scope of appointment. Please don't make that mistake. I know this software is really fun to use, but let's not forget basics. And again, I have videos on the sales process. So if you're lost on that, I'm happy to share those videos. They're on our YouTube channel for sales process, and I've sent those out to everybody as well. So just please make sure that you've got, the order of attack there. And the first thing is the scope of appointment. Okay, so get that scope of appointment done first, and then you can go out to the enrollment. You really should not be discussing benefits until you've got your scope of appointment complete. Okay. The other question that pops up is, should I select all the boxes? And the answer is, it depends on the member, but yes, technically, if you don't know if you're going to talk about prescription drug coverage or Medicare Advantage plan or supplements, just select them all. It's not a big deal. It's better to select them all than having to redo a scope of appointment because they decided to switch gears on you and now they went to supplements, So just be prepared. That's always a good thing to have. So get that scope of appointment completed first. We don't want to have any issues. And in some cases, you cannot even submit the application until your scope of appointment is completed, and then you can go back and submit the application. So, I know you guys are fast and furious out there. Just take your time and get that part done so we don't have any mistakes. Okay, the HRA form. So per request, we've had quite a few people that were asking about the health risk assessment form. And yes, Hpm Shop has integration for certain carriers. Not every carrier has the HRA availability, but I do want to share with you guys where to find that information. So on your dashboard, you go to Agent Training Materials, which is right there at the top. And then on the left-hand side, you'll see Documents, and you'll scroll down to Health Risk Assessment. So this is the Health Risk Assessment form that pops up, and I'm just going to read it to you guys. But you should have a copy of this. If you have any questions, let us know. But this goes through the actual HRA submission. So we use a company called Connector DRX to run the health risk assessment forms. So we now offer health plans the ability to collect initial health risk assessments on our Plan Compare One platform, which is Hpm Shop. This new feature gives newly enrolled members and agents the ability to complete an HRA immediately after submitting an enrollment for a participating health plan. So remember, not all health plans are participating in the electronic HRA form. So you will see it there. So we're going to go through that. So who can submit an HRA? Health plans may have different rules regarding the collection and submission of HRA data. The health plan controls who can submit an HRA, either the beneficiary, the broker, or a call center agent. Brokers and call center representatives can collect and submit the HRA following the enrollment completion, or the beneficiaries can move on to the HRA if they've completed the enrollment themselves. So if you've sent out a link and your member enrolls themselves, it'll pop up to complete the HRA as well. HRAs must be submitted at the time of the enrollment and cannot be completed at a later date. And this is as of AEP 2022. Now, there are several rules for certain carriers, like I believe Care Plus. You can go back out to their site and submit an HRA form, and that's okay. But using Hpm Shop, you've got to do it at the time of the enrollment. You can't go backwards in the enrollment. So accessing HRA via the enrollment confirmation page. So those of you that are online right now, you'll see at the end of it, it says application submitted, and then it has the applicant's details on the right side, what to expect. And then the next step is a big yellow button that says to complete the health risk assessment form. So upon clicking the complete health risk assessment button, the site will redirect the user either to a form hosted on our platform or to their external site. So it could bounce you out to another site. So just know that. HRA hosted by Connecture Hpm Shop. The member completes the HRA on the site and receives a confirmation. Okay. A record of the completed HRA will also appear in their profile. So when you go back out to the profile, you'll see the confirmation number up top. You'll see the plan, the submitted date, the effective date. And then on the right side there, you'll be able to see that the health risk assessment form is already completed and right there for them. The HRA data will be exported nightly in a tab-delimited text file like the enrollment report. So just some technicals there. We submit the applications every day, 24 hours behind. So whatever applications you turn in today will be sent over to the carriers tomorrow. The HRA hosted externally. So when an HRA is hosted externally, the user is redirected to the external HRA. Data is not collected and therefore an export file is not generated. So basically, if you are bounced out to another carrier site, let's say Humana, for instance, then whatever you do on Humana's site is through you and Humana. It will not be sent over from Hpm Shop because you're using that. However, Hpm Shop is able to report on the number of times a user clicks to start an HRA and can provide this information via our Insight report. So if you're curious to see if your members are doing the HRA forms, if you're sending out the applications, we have a little bit of that data as far as, if they're clicking through. So the workflows. Below is the HRA workflow, whether hosted by Hpm Shop or via an external link, and it depends on the health plan requirements. And so those of you that are online can see this little graph that we've got going on here, and I'll go through that in a minute. Hpm Shop updates plan data to identify those plans with an HRA, whether the HRA is hosted by Hpm Shop or has an external link. Health plan must provide the link the user will connect to if it's an external link, and the type of user that can complete an HRA. So I'm giving you the technicals of this, and basically, if you complete an application, the big yellow button will be right there, and you can choose to do the HRA or you can choose not to do the HRA. I do recommend you doing it because it's extra money. Most of the carriers are paying you an additional administration fee for completing that HRA form. So take your time to do it on Hpm Shop. So as the walkthrough, if the user submits an application, if the HRA is available for this user, if it's not, then you're done with the application, okay? Or you can bounce out to the website and do it through their website. If the user submits the application and there is an HRA form, the user will click the enrollment confirmation page. And if it's hosted on the site, the user will complete the HRA form. The HRA confirmation page and emails are sent to the user. And HRA is displayed within the enrollment history reporting and the file export, okay? If it's not hosted on Hpm Shop, then the user will be redirected to an external link to complete the HRA, okay? So that's how it flows there. I'm hoping that helps. And again, just as a reminder, not all plans have the HRA form integrated here, but you do have the ability after completing the application to bounce out to the external sites to get those done, okay? All right, so that's HRAs. Okay, now we've got a couple of videos here that I want to share, and I know we have a question or two, but I do want to share with you a video here that I'm seeing a trend. So one thing that I've asked all of you to really consider is when you're collecting application details, and now more than ever because we're using digital technology to complete the application, is get those email addresses, okay? Most people have an email address, so you want to collect that. And here's another reason why. These carriers, after you do the enrollment and they're confirmed, they're getting an email confirmation with videos explaining their basic benefits just as a reminder and just as a reiteration of everything that you've gone through. So I'm going to share the example of Simply Healthcare, and this is something that is trending right now, and we're going to continue to see this. So hopefully you guys can hear this okay. I'm going to go ahead and play the Simply new member video.
Hi, thank you for being a member. We're excited to tell you about the amazing Medicare benefits you have access to. Benefits that are here to help support both your health and wellness. This video will only take a few minutes and covers the topics listed here. You can pause at any time using the controls at the bottom of your screen, or rewatch as many times as you'd like. Essential extras. Your plan includes up to 2 extra benefits called essential extras. You can choose the benefits that best fit your needs. Here are a few of the options available to you. There are resources like transportation to and from appointments and healthy meals that can help make everyday life a little easier. To select a benefit, click on My Plans, Medical, scroll to Benefit Details, and select Essential Extras. If you have already selected a benefit this year, you will automatically be enrolled in the same benefit for 2022. OTC allowance. Your plan gives you an over-the-counter allowance for health products. Here's the amount you get every month. Use it on items like these. The full list of eligible items and participating retailers, as well as your current balance, can be found on your secure online account. Just select My Plans, then Medical, Benefit Details, and over-the-counter items. Plan savings. Another benefit of your Medicare plan is the discounted rates we've negotiated with a large network of doctors and hospitals. To see your total plan discount, go to Claims and Payments, then select Claims History. Preventive Care. Getting all your wellness exams and screenings is an essential part of staying healthy, and it's no cost to you when in-network. Here are some examples of the free screenings and vaccinations you have access to. To see your full list of recommended screenings and vaccinations, go to My Health Dashboard, select Programs, then click Preventive Health Guidelines. Prescription delivery. Another plan benefit is home prescription delivery through IngenioRx. Simply click the button on your screen to sign up. We hope you enjoyed this and the many other amazing Medicare benefits available to you with Anthem. Thank you again for being a member.
So again, this is a video that I see trending a lot now with carriers that are going to continue to, put these things out, but it's only going to make sense for those folks that have an email address, because that's how they're sending out these video links. And again, it's just that confirmation from the health plan saying, hey, you've been enrolled and here's some great things to know. Before I forget, I do want to remind everyone about the Part B increase for 2022 coming up in January, because I don't want anyone to be surprised or sidelined because they were unaware. So we're going to continue to monitor this and then also email and text everybody as well. But the new 2022 standard Medicare Part B premium is $170.10. That is a massive increase. It's the largest increase on Medicare Part B premium ever. I think it went up by 29%. So it's a huge jump from where it was, just this year. So going from 148.50 all the way up to 170.10 is a very, very big jump. A lot, and a lot for most people. That's an extra $350 a year that they weren't expecting. So now more than ever, give back plans are going to be key and crucial for your success. So take a look at those. Make sure your members know that there will be an increase in 2022 going in January, because that conversation right there will not only show that you are educated, connected, but it also shows that you're looking out for your members. And one reason why is because you're changing people's health plans, and they're going to assume that the change that they made with you was detrimental, and that affected their Social Security, and now they pay more. And so, get that out of the way. Show them. You can find that information on CMS, on Medicare as well. So that is public information. You can find all sorts of articles on it too if you want to print and share that, as long as it's government or health plan related. I would go ahead and carry that with you or share that with your members. But the new Medicare Part B premium is starting at $170.10. Some people pay more because they make more. So that's just the standard, $170.10. And we'll talk about IRMA on another day, which is the income related monthly adjustment. So we'll talk about that on another day. But to close out the call, I do want to share with you a quick video. I know we're running short on time this morning, but I do want to share a video about appointment setting. And this is from Mark Wayshak. This is a guy that I always thought is a great person to learn from when it comes to basic sales techniques. So I'm going to go ahead and jump into this video and share with you some appointments here.
Nothing but just pure whiteness. It's like a white cow in a snowstorm. But it doesn't have to be this way. And the reality is that if your calendar is empty, you are simply never going to hit your sales goals. I come across so many salespeople who, if they could just get in front of more people on scheduled appointments, they would be so much more successful and able to blow past all of their sales goals. So having a systematic approach for setting appointments is going to be key to your success. In this video, I'm going to show you 5 steps to setting an appointment with any customer. Check it out. Number 1, know your IPP. Now, IPP stands for Ideal Prospect Profile. And so before we even make any dials or send any emails or do anything in our outreach, we first have to be insanely clear on exactly who we want to be talking to. And the reason that this is so important is that remember how much effort it takes to actually just get someone to put their hand up and say, yeah, I'd like to talk to you. But let's say it works, and then that person turns out to be the completely wrong person. Well, that's because the data and the ideal prospect profile that we had was incorrect. And we didn't even want to be talking to that person because they were never going to be able to buy. So the more clear we are about our IPP, the more effective any of our outreach is going to be. And so one of the best ways to actually tighten up your IPP is to identify who you don't want to be speaking to. Who are those likely candidates that might come across that you know are likely to not be a fit? Being very clear on who you don't want to talk to is going to help you clarify exactly the person you want to be connecting with. Number 2, hyper-personalize your message. This is modern prospecting in a nutshell. The more personalized your outreach is, the more effective it's going to be. And remember, this also goes back to your ideal prospect profile. If you have a really tight ideal prospect profile, you can actually personalize a lot of your messages simply by having a really tight ideal prospect profile and then sending out a pretty similar message to each person. Because if you're sending messages to people in the same industry who are dealing with the same problems, then your message can actually be, quite frankly, pretty similar to the other messages that you sent out earlier. Another way, of course, to hyper-personalize is to really have personalization fields in any of your outreach. So pointing out specific things based on some simple research is going to really help the person say, oh, okay, this is a real person who's done their homework, who knows about what we're doing, and that's going to get them to open up much more and be much more likely to actually schedule an appointment. Number 3, demonstrate very quick insight. So one of the keys to any outreaches in order to schedule appointments is that you've got to bring some authority. You've got to bring some insight to the table because your prospects are busy. They're reached out to all the time by people. And what they don't want to do is just get their brains picked or probed by some salesperson who's trying to learn about their business or their personal life or whatever it is. What you want to do is make sure that when you're reaching out to anyone, in any medium that you have some really valuable but quick insight that you can demonstrate up front that's going to get the prospect to say, you know what? Yeah, that makes sense. I am willing to talk to you. That's one of the keys here. It's not about your offer. It's not about your pitch. It's about demonstrating some very quick insight right up front. Number 4, understand them. In any outreach that you do, once you've demonstrated that quick insight, now it's time to flip the switch and get them talking. And so the way we do that is we want to have a set of questions in any outreach that we're doing to get them to open up. Once you get them on the phone, you want to be understanding exactly what's going on in their world. What are their central concerns? What's most relevant to them? So again, the key here is that you've demonstrated quick insight at the beginning of the conversation or in any outreach, and then you're turning it back on them to get them to start opening up. The more your prospect feels that you genuinely understand their situation, the more likely they are to want to schedule that appointment and ultimately buy from you. Number 5, make a recommendation. Once you've got someone who's actually interested in connecting with you and is willing to talk to you, now is time to make that recommendation. And so what you want to ultimately do is not just go for some close or try to just schedule an appointment right away, but instead you want to make a recommendation. Something along the lines of, George, would it be okay if I made a recommendation? They say, sure. And you say, okay, great. How about we schedule a Zoom conversation where I can share with you some best practices of exactly what we're seeing other folks in your situation are dealing with right now. Would that make some sense? And now the prospect's like, yeah, sure. And now you have an opportunity to schedule that appointment. The key to appointments is that we're bringing value in that next step, right? If they just think that you're just scheduling an appointment to try to sell them stuff, they're going to be pretty guarded and uncomfortable. But once you create some context for why that next step makes sense through your recommendation, now they're going to be much more likely to agree to that next step and actually show up. So making the recommendation is a really important step to ultimately scheduling that meeting. So there are 5 steps to setting an appointment with any customer. And if you enjoyed this video, then I have an amazing free training on the step-by-step formula to closing more deals. Just click right here to get registered instantly. Seriously.
So they've got some great web videos as well on Mark Wayshak. So if you're interested in learning more about what he has to offer for sales, great resource. He has a lot of free stuff on YouTube as well. But just wanted to share that 5 ways to set appointments with your clients, because I know some of you might be struggling a little bit, and it's back to those basics right there. And I think he can really bring value to what you're doing out there. So with that, that's the end of our call. I do appreciate everyone being on the call this morning. Again, if you need us, you know how to reach us. That's 844-696-3975. And we hope you guys have a fantastic last full week of AEP. Good luck out there and happy selling.